Welcome to Citrus Pie Live Studio. Today we are here with Dr. Klinghardt, who is a medical doctor and PhD in Seattle. And we are going to discuss the topic of mercury, heavy toxic metals in the body and the effects of mercury in particular on the human body. So Dr. Klinghardt, thank you very much for being with us today.
Thank you for inviting me.
Thank you. There is more and more talk about potential negative effect of mercury over time. This is something dentists didn't question back in the 60s or 70s and 50s. We all had feelings with mercury in our teeth and nobody questioned it. But today we know, of course, that mercury can create some pretty serious problems. Could you tell us a little bit about the knowledge around mercury today, how it affects the human body?
Yeah, first of all, it's important to know that there's never been any enzyme found in our body. We got about 150,000 that is not blocked or destroyed by mercury. So mercury is the only toxin that has that vast of an effect. And also, it's never been shown that there is a minimal dose of mercury that's safe. So some people are injured with very, very tiny doses. So what that means is mercury can be at the core or at the bottom of any illness, any cancer, any neurological disease, any emotional problem, any psychiatric problem. And detoxifying mercury has been the core of my holistic treatment protocol for all chronic illnesses. And we've been very, very successful positioning the mercury detoxification at the core of any program, whether it's chiropractic manipulations or orthopedic work or chronic fatigue that we're treating or cancer, the mercury detox at the core. And maybe just a few more things. It's important when a person is exposed to mercury. When the fetus is exposed to mercury, it has devastating lifelong consequences. And the later in life you're exposed to, the less. So if a mother has amalgam fillings and evaporates mercury, that can have much more devastating impact on the growing child in her than, for example, if a person is exposed to it when they're in their 20s or get a fresh amalgam filling.
So, well, first of all, what comes to mind is how long ago did that knowledge become available? That's the first question I have. And then how widespread is the knowledge within the medical community and how serious the problem is, and what is the medical community as a whole doing about it?
Mm-hmm. So the use of amalgam, which contains 50% mercury in its weight, has been around for about 170 years now. And immediately when it was invented by two French brothers, there was the first amalgam war, it's called. The physicians realized people are having health problems and tried to stop it. It was stopped for a while and then re-emerged because it was inexpensive and did save teeth. And so the second amalgam war was starting in the 1980s, so about 30 years ago, and is not finished yet. The science is very clear. Placing amalgam in the mouth is a very bad idea because it evaporates mercury into the brain. And there is now so many better materials out that are a little bit harder. The skill to place them is a bit harder for the dentist to learn. So there's been resistance. But I think overall the trend is people do not want to have black-looking things in their mouth. They like to have natural, white-looking things. So amalgam clearly is on the way out for the wrong reasons maybe, but it is on the way out.
Well, first of all, thank you for clearing something up. I thought French people only came up with amazing inventions, and you made me understand that that's not always the case, and maybe this invention was not the best. So what advice would you give people who still have mercury in their teeth? First of all, what you would recommend?
Mm-hmm. Yes, so it's important also to know that the toxic effect is synergistic with other things. That means that it's a combined, the exposure to insecticides, pesticides, other metals, and then the mercury is just one more thing in our body. And so if a person is pretty clean and has good genetics for detoxification, people tolerate amalgam fillings. But that number gets increasingly smaller because we're all exposed to all the other things. And so 50, 60 years ago, amalgam fillings were quite well tolerated by most people. Today, it is hardly tolerated by anybody because of the synergistic effect with all the other things that are now in the system. And replacing the amalgam fillings with a non-toxic filling is one of the easiest ways of reducing the overall amount of toxins in our body, and therefore should always be first in the treatment of chronic illness. Now, if somebody is completely healthy and has a lot of energy, if it's a woman who will have children, I will strongly recommend to have the amalgam removed before she gets pregnant.
But the question comes to mind, though, when the procedure is done to remove that amalgam, that it has to be done well, because then what you might think is maybe some pieces of mercury are going to be ingested or vapors are going to be ingested. Is that not the case?
Yes, the dentists that are removing amalgams should be trained. There is a training program. The group that offers it to the dentist is called IAOMT, the International Academy of Oral Medicine and Toxicology. And they have a very strict protocol that guarantees that the patient is not poisoned during the removal process. But it is dangerous for a patient just to go to just any dentist, because any dentist says, of course I can remove your fillings. But the precautions, a separate air supply for the patient, a special suction that's placed on the tooth, a special allergy test to figure out which materials can be put in there. There is a lot of precautions that need to be put in consideration before taking out the amalgam fillings. But it can be done safely by a trained dentist.
The next question I have is, okay, we talk a lot about the fillings, but mercury is also found in other places like food and the environment. So the exposure to mercury can happen in other ways as well. Can you tell us about that?
Yes, especially farmed fish has been found to be very, very full of mercury. Food high up in the food chain concentrates the mercury. In fact, if a smaller fish is eaten by a bigger fish, the bigger fish over a lifetime concentrates the mercury from the smaller fish 20,000 times. And then if you take that 4 or 5 times up, it makes a lot of fish high up in the food chain non-edible. Now we have the problem that the fish of the Pacific is also full of radioactive cesium. So we have another metal that behaves in many ways similar to mercury that we have to also consider.
So there are some links, obviously, between having a high toxicity of mercury in the body and some cancers, I guess. Could you share with us maybe some cancers that are quite widespread where you see a link with mercury toxicity?
Yeah, the worst source of mercury, that's ethyl mercury, is from the flu vaccine or the hepatitis B vaccine, where we see 20, 30 years later really like an increased cancer rate. I can't prove that because I can't keep the statistics, but between me and my European colleagues that keep long records of their patients, it seems to be very clear that certain forms of mercury are highly carcinogenic down the road and should be avoided. You know, the treatment for the flu is take a high dose of vitamin D and vitamin A for a few days. Hepatitis B, your risk of hepatitis B is if you're an intravenous drug abuser or have unprotected sex with a lot of people. But if you're not a drug abuser and don't have unprotected sex, if you're in a stable relationship, there's really no argument to be made to have to be vaccinated for hepatitis B. So the other forms of mercury also play a role. They may be less toxic to the system, but really, quite honestly, we don't know for sure.
Well, that's part of the problem, is these problems happen sometimes 20, 30 years later. And there's no way of being able to prove a correlation.
Yeah. I've been a physician for 40 years and kept my eyes on patients for 40 years. And that is relatively significant time span. And I can certainly say here from my experience, it's not a good idea to have mercury in your system in any form or shape or any compound of it. And it's a good idea to stop those sources of mercury and detoxify what's in the system as much as that's possible.
Dr. Klinghardt, thank you very much.
Thank you,
Thank you.
Laurent.